Hello, I'm Dr. Manal Ali. I'm going to speak about assessment stuttering. Stuttering is a type of speech disorder characterized by frequent repetition, prolongation, and/or blockage that interrupt the flow and rhythm of speech. It is associated with secondary behavior, involuntary movement involving head, neck, limbs, trunk. There is positive or negative avoidance of speech. The incidence of stuttering, it is a greatly variable. It ranges from 0.8 to 3%. Most of researchers agree that the incidence is about 1% of general population. Onset of stuttering, the majority of cases of stuttering occurs in preschool age. The earliest age of the onset of stuttering was about 18 months. The latest age was between the age of 7 to 13. Gender ratio, there is complete agreement that males are more affected than females. The ratio is about 3 males to 1 female. Types of stuttering, there is developmental and acquired stuttering. Developmental stuttering start between age 2 years to 6 years, do not start after the 12 years, 50% genetically based, and 15% in first degree relative. Acquired stuttering starts at any age caused by specific neurological impairments, including traumatic brain injury, stroke, certain neurological disease, and medication. Differential diagnosis between stuttering, developmental stuttering, gradual childhood onset between 2 to 6 years, caused by genetic and developmental factors, characterized by repetition, prolongation, and blocks on initial sound and syllables, response to frequency-inducing condition as choral speaking, rhythmic speech, prolonged speech, singing, and etc. Chronic stuttering continues from the childhood to the adolescent and adulthood. The second type of stuttering, neurogenic stuttering, sudden onset in adult caused by traumatic brain injury, stroke, and etc. Repetitions characterized by repetition, prolongation, blocks in any position. Doesn't respond to fluency-induced condition, choral speaking, rhythmic speech, prolonged speech, singing. May occur with aphasia and/or dysarthria, stuttering during automatic speech occurs, such as counting. The third type is psychogenic stuttering, sudden onset in adults caused by emotional stress, trauma, etc., characterized by repetition, prolongation, blocks in any position, atypical fluency disruption, excessive repetition on each phoneme, worse stuttering symptoms on easier speaking task, and unusual grammar, rapid improvement of stutter after disclosing sensitive emotional information. Assessment of stuttering. The goals of assessment is to determine if the person is a true stutterer, to describe the pattern of this fluency, and to determine most effective strategy of treatment. Assessment of stuttering. First, you take the case history, the personal history, name, age, gender, hand preference, educational level, occupation, and scholastic achievement. Family history, sibling, order among them, and similar condition, the family, consanguinity, parents' education. Past history, ask about the prenatal and birth history, developmental history, and illness of childhood history of delayed language development, history of fits, neurological disorder, and medication. The present history include complaint, onset, course, duration, and ask about special difficult or feared phoneme or word, special difficult word position. The problem gets worse when speaking to stranger, exams, speaking on phone, anger or excitement. The problem gets better when speaking with family, reading, automatic speech, slow speaking, word substitution or circumlocution, avoidance of speech situation, social isolation, patient recognition of the problem, and the impact of the complaint on the patient, patient rating of severity 0 to 1 to 2 to 3, and effects on personal, school, and vocational behavior. Then test the developmental phase. Bloodstein has provided a four phases category of the development of stuttering. Phase 1, characterized by being episodes. Stuttering occur when excited, and it is mainly repetitions. No concern about the problem. Phase 2, the child is aware of the problem but pays no attention to the stuttering increasing chiefly under condition of excitement. Phase 3, stuttering starts to appear mainly in response to specific situations and certain sounds or words. Stutterers start to use word substitution and circumlocution, and there is no avoidance of speech situation. Phase number 4, avoidance of speech situations, and he may even isolate himself from others besides struggle reactions. Then we come to the speech assessment. First, you take speech sample, obtain valid sample, automatic, such as count, days, months, nursery rhythm, picture description, monologue, telling story, relating as event, reading at age level, and sample is usually between 150 to 400 words. Stuttering events are identified from audio tape, videotape, transcriptions of those tape, behavior description of stuttering. Speech assessment, you find the types of stuttering, which are core behavior, repetitions, blocks, prolongation, and blocks. And find the stuttering like behavior, polysyllabic word repetition, phrase repetition, interjection, silent pause and revision, or incomplete phrase. Assessment of stuttering severity. First, you assess the frequency. It means number or percentage of moments of stuttering or stuttered words or syllables. Percentage of cerebral stuttered, total number of disfluency, word or syllable, divided by the total number of words or syllables, and then multiply the result by 100. Below 3% is non-fluency, 3 to 5% is low, and 5 to 8% is mild, 8 to 12% is moderate, 12 and more percent is severe stuttering. Find the duration. Duration, the average duration of 3 longest moments of stuttering. Typical duration 3 seconds, can be speech rate, express the speed with which the person is able to make information flow. Speech that is too slow and too fast makes communication difficult. And syllable per minute, number of syllables spoken in 2 minutes. It is about 196 syllables per minute. In adults, it is 162 to 230 syllable per. Then you assess the introspective concomitant, feelings of frustration in the effort to speak, feeling unable to utter the intended word because lips and are tied together, tongue sticks to the roof of the mouth, throat closes firmly. feeling of muscular tension, muscles of articulation, and phonation and respiration could be in arms or also affective reaction. Before blocks, there is fear of being blocked. During the block, the patient feel confusion. After the block, he feel relief and tension reduction, followed by frustration and anxiety about the future stuttering block. Formal stuttering severity test. There are many tests for measuring the stuttering severity, such as stuttering prediction instrument in young children, stuttering severity instrument 4, and overall assessment of the subjective experience of stuttering, behavior assessment battery for school-age children who stutter, and KIDDI CAT communication attitude test for preschool and kindergarten children who study. Clinical examination. You should examine also language, voice, and articulation exam, oral mechanism examination, the structure and function of the oral mechanism are examined, hearing assessment, neurological examination, and psychometric. Find the grades of stuttering severity. Number 0 is there is no stuttering, fluent, and very mild stuttering on less than 1% of words, very little relevant tension, movement of this fluency, 1 second duration, simple pattern of stuttering, no apparent body movement. In mild stuttering, there is stuttering on 1 to 2% of words, tension little perceptible, and very few movement of stuttering last about 1 second, no trunk or frank associated body movements. The mild to moderate stuttering is about 2 to 5% of words. Tension start to appear but not very distracting, and pattern of this fluency are simple, no associated movement of body, arms, legs, or head. Moderate stuttering on about 5 to 8% of words, tension occasionally distracting, this fluency average 1 second in duration, and this fluency characterized by complicated facial grimace, distracting body movements. Moderate to severe stuttering on about 8 to 12% of words, tension is constantly noticeable, and stuttering moments is last for about 2 seconds, few distracting body movements. Severe stuttering about 12 to 25% of words, apparent tension, this fluency average 3 to 4 seconds in duration, increased distracting facial and body movement, and very severe stuttering on more than 25% of words, very increased tension, stuttering moment lasts more about than 4 seconds in duration, and very increased distracting facial and body movement. At last, you write your recommendation, the effective strategy of treatment, and the results of the evaluation and the recommendation are discussed with the client and or caregivers at the conclusion of the assessment. Thanks.